So we'll start with our overview of the NRP 8th edition and what are the changes from the previous edition initially, right? So first is the 4 pre-birth question that you're going to ask the obstetrician. So the 7th edition, the 4 pre-birth question was, first is the gestational age, next is how is the amniotic fluid, is it clear or not, third, how many babies, fourth, additional risk factors. Okay, so now in the latest edition, what are the changes? These 3 questions are same, gestational age, amniotic fluid, additional risk factors are same. How many babies has been replaced by umbilical cord management plan? Should you go for a delayed cord clamping or should the cord be clamped at once immediately? So that immediate versus delayed cord clamping. So this has to be discussed with the obstetrician prior to birth. So these are the 4 pre-birth questions. Okay. So next coming on to the initial steps. So the initial steps we know warmth, dry position, suction, stimulate. So these 5 points, no, I have just told. These 5 were reordered a little. Okay, so the common practice is to first warm the baby, dry the baby, stimulate the baby, that is you do a tactile stimulation, you position the baby and you do a suction if needed, suction of the airway if needed. Okay, these 5 steps have been reordered and this what we have seen right now is the newer one according to the latest edition, that is the 8th edition. So, warm, dry, stimulate, position, suction. So, WDSPS. WDSPS. Remember like that. 7th edition, it was little, the order was changed. These 5 were there, but the order was changed. Just remember the current order alone. The next change is electronic cardiac monitor. Whenever you are considering an alternative airway, so the newborn is grunting, the efforts are not up to the mark, you are considering CPAP or you find that the heart rate is less than 100 and one needs to start positive pressure ventilation. That is when you start the positive pressure ventilation, you ask your assistant to start the cardiac monitoring and the pulse oximeter. So all these have to go hand in hand. So whenever an alternative airway becomes necessary, a cardiac monitor is recommended. Okay, don't rely on the pulse oximeter for the heart rate, right? So the pulse oximeter reading can be fallacious if the peripheral circulation is not satisfactory. So do not rely on the pulse oximeter for heart rate measurement. Do connect with the cardiac monitor. Okay. So when should one stop the resuscitative efforts? According to the 7th edition, it was 10 minutes of resuscitation, but now it has been relaxed around 20 minutes after birth. And of course, the decision has to be individualized on the patient and the contextual factors. Next, coming to the epinephrine. Previously, we were referring to as adrenaline. Now, most of us have started referring to as epinephrine. So, throughout the NRP, it is referred to as epinephrine instead of adrenaline. 1. Dosage of epinephrine. Again, the range was given in the 7th edition, right? For both the IV and the IO dose, there was a range. For IV or IO dose, the range was 0.01 to 0.03 mg per kg. IV intravenous or intraosseous dose. Endotracheal dose, the range was mentioned as 0.05 to 0.1 mg per kg. Whereas in the 8th edition, the range has been skipped. It has been mentioned in many parts of this, but in the algorithm, as you can see, the range has been skipped. Rather, the absolute value has been given along with ml per kg for easy calculation when you are resuscitating the baby. Okay, instead of the range, one has to remember the IV or the intraosseous dose as 0.02 mg per kg or 0.2 ml per kg of the 1 in 10,000 solution, right? So you, instead of calculating in your mind mg milligram and then converting to ml, it is fine that you can just tell as 0.2 ml per kg because your assistant has already prepared the epinephrine. 1 ml has been taken mixed with 9 ml of NS and the resultant solution will have 1 ml will have 0.1 mg of epinephrine. Okay, so you can just tell approximately if you know that the weight of the baby is 2 kgs. So 0.2 ml per kg will be 0.2 into 2. It is rather easier in that way. So that range has been simplified for calculation and efficiency also, okay, during your resuscitation. And endotracheal dosage similarly, it has been mentioned as 0.1 mg per kg, which is equivalent to 1 ml per kg. The range has been skipped. Otherwise, it is not an error to remember the range at all. It is not at all wrong to remember the error, but this is what has been modified in the newer NRP.